Mental health and suicide awareness prevention. Mental health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Mental health is not just the absence of mental health disorder. It is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. Characteristic of a mentally healthy person: he feels comfortable about himself, he feels reasonably secure and adequate, he neither underestimates his own ability. The mentally healthy person feels right towards others. This means that he is able to be interested in others and to love them. He is able to like and trust others. The mentally healthy person is able to meet the demands of life. He is not just bowled over by his own emotions of fear, anger, love, or guilt. Mentally health services: early diagnosis and treatment, rehabilitation, group and individual psychotherapy, mental health education, use of modern psychoactive drugs, aftercare services. Signs and symptoms: eating or sleeping too much or too little, pulling away from people, not engaging in your usual activities, having low energy or no energy, flat and unmotivated, feeling numb, like nothing others or can't be bothered with anything, having unexplained aches and pains, feeling helpless, trapped or hopeless about the future, using alcohol or drugs, feeling unusually confused, forgetful on edge, angry, upset, worried or scared, fighting a lot with family and friends, experiencing severe mood swings that cause problems in relationship with family or friends, having upsetting thoughts and memorizes that you can't get out of your head, hearing voices or believing things that are not true, thinking or harming yourself or others, struggling to perform daily tasks like taking care of your personal hygiene, getting school work done, or even getting to school. What is prevention? The review focuses on the current state of art. Prevention starts with definition or prevention in mental health aims to reduce the incidence, prevalence, and recurrence of mental health disorders and their associated disability. Preventive interventions are based on modifying risk exposure and strengthening the coping mechanisms of the individual. Suicide means ending your own life. It is sometimes a way of people to escape pain or suffering. When someone ends their own life, we say that they died by suicide. A suicide attempt means that someone tried to end their life but did not die. Introduction of suicide. Suicide is the act of intentionally causing one's own death. Suicide is the act of purposely ending one's own life. Nearly 1 million people worldwide commits suicide each year, which with anywhere from 10 to 20 million suicide attempts annually. Suicide is the first leading cause of death for people 10 to 24 years of age. Major causes of suicide: an untreated mental illness, genetically predisposed depression, fear to face the problems. Other causes: the death of a loved one, physical, verbal, sexual, alcohol, drug abuse, feeling helpless, bullying, low self-esteem, loss of hope, being victimized, intense emotional pain, a serious accident and illness, a horrible disappointment, a serious loss such as job, house, and money, a feeling not being accepted by family, friends, and society, inability to deal with a perceived or failure. Suicidal behavior: self-inflicted injuries such as cuts, burns, or head banging, reckless behavior, unexplained accidents, verbal behavior that is ambiguous or indirect, voices are telling them to do bad things, requiring for euthanasia information, inappropriate joking, stories, or essays on morbid themes. How to help? How to help people to prevent suicide? Be direct, talk openly, be willing to listen, allow expressions of feelings and accept the feelings. Be non-judgmental, don't lecture on the value of life. Get involved, become unavailable, don't dare him or her to do it. Who can help? Healthcare professionals, physicians, pediatricians, nurse practitioners, physician assistant, mental health professionals, psychologists, social workers, primary and secondary school staff, principal, teachers, counselors, nurses, college and university resource staff, counselors, student health services, student resident services, resident hall directors and advisors. Suicide prevention: a suicidal person may not ask for help, but that doesn't mean that help isn't wanted. Most people who commit suicide don't want to die, they just want to stop hurting. Suicide prevention starts with recognizing the warning signs and taking them seriously. Also, talking openly about suicidal thoughts and feelings can save a life. Thank you. So that's all for our topic for today.